Hello everyone, I am Dr. Usama Ibrahim from Ease and Different Radiology. My lecture today about the brain-specific MRI sequence as a basic learning for the brain MRI, and this is actually level 3 for step-by-step learning MRI imaging. So let's get started. Learning objective from my presentation today is to be more familiar and awareness about the brain MRI sequence. Today I will talk about 8 sequences from Brain MRI, including T1, T2, FLAIR, T2 star, gradient echo, susceptibility weighted images, diffusion weighted image, and apparent diffusion coefficient map. As I talked in previous presentations about the differentiations between T1 and T2, in T2 the fat and water appeared bright. Fat can be detected in subcutaneous tissue, in parapharyngeal spaces. Water can be detected in the ventricles, subcortical sulci, and CSF in the spinal canal. However, in T1, fat only appeared bright and water appeared dark or low signal intensity, as we see in these images. So, this image is axial image for the brain, which is showing the subcutaneous fat is bright, however CSF is low signal, so this is representing a T1 signal. Only in T1 sequence, the white matter can be differentiated from gray matters, as the white matter is brighter than the gray matter. The other brain MRI sequences, the white matter appeared darker than the gray matter, and this is another sign which can differentiate T1 MRI sequence from other MRI sequences. Another sequence of MRI in the brain is the diffusion weighted image sequence. Diffusion weighted image sequence called DWI, and DWIs, the white matters, as I told in the previous slides, appeared darker than the gray matter, and CSF also appeared dark. And the image outlines appeared hazy, like this. Also ADC map, the image appeared as a drawing image, and this with the diffusion weighted image representing the restricted diffusion abnormality. Another image of the diffusion weighted image and the ADC map. As we see in diffusion weighted image, CSF appeared dark, and the white matter is darker than the gray matter. And the outline of image appeared hazy, as we see here the orbits can be discriminated clearly. So this is DWI. And this image, which appeared as a drawing image, is representing a map or ADC map. Both images can be identified also by another way, by these parameters like TR, TE, and flip angle. These parameters representing the milliseconds of the radio frequency pulse which governs to produce these images. And by these parameters also I can define the MRI sequence. Also, the study name can be written in the bottom of image if you examine the image in your workstation. However, we define the image by the other finding like CSF, white matter, and haziness outlines, drawing, and like this. This diffusion weighted image can be used for detections of acute ischemia as a bright signal in diffusion and low signal in ADC in correlations to each other. Another MRI sequence is a FLAIR image, which representing a fluid attenuation inversion recovery. And this only suppressed the fluids who is flowing, like CSF flowing in the ventricles and subcortical sulci and CSF spaces, and also in the spinal canal. Flowing fluids suppressed by this technique. However, the fluids which is not flowing appear the bright signal in the FLAIR image. And this is sagittal plan for the brain, which is showing the corpus callosum, spinal canal, brainstem, cerebellum, and cerebral hemispheres all have no abnormal signal in FLAIR. FLAIR, I described it before in the previous presentation as the background of black background and abnormality appearing as a bright object within the background. So this technique is done to appear the bright abnormality clearly within background black. The gradient echo, another MRI sequence, which shows the abnormality is dark dot within the white background, as we will see in next slides. Another MRI sequence which is showing the background is white and the hazy outline. So this sequence is called T2 star or gradient echo or ACWI, susceptibility weighted image. Again, this is the T2 star or GE ACWI, susceptibility weighted image, can be used to highlight the presence of blood hemosiderin products, which appeared as black dots within this white background. So, white background with hazy outlines is represented T2 star. This sequence used for detections of hemosiderin, which appeared as a black dot within this white background. This is another 4 different sequence for MRI brain. Can you tell which one is this sequence? If we look first for the CSF, it appeared bright here, and also fat appeared bright, so this one is a T2 sequence. Comparing with this sequence, which is T1, due to CSF is dark and subcutaneous fat appeared bright. So this is T1. Also white matter appeared brighter than the the gray matter, brighter than the gray matter. Comparing with this sequence, which is showing also CSF is dark, however bright white matter appeared more darker than gray matter. White matter appeared more darker than gray matter. So these sequences are not T1. Only when white matter is bright is a T1 considered, and also confirmed by presence of this high signal of fat in the retroorbital spaces and also in the subcutaneous region. So what is this sequence? This one is T2 due to CSF is bright and the fat is bright. However, these are FLAIR image. FLAIR due to white matter is darker than gray matter, with CSF is also low signal, and also the outline is defined clearly. Comparing with this image, which is showing a hazy outline, so this is the DWI or diffusion weighted image. Also, if there are any confusions, look for the parameters TR, TE, and flip angle. I will discuss these in details in the next presentation. How to differentiate the sequence through the parameters. And also, the sequence name is written in the bottom of image, as we see here is T2 image or sequence. So when flowing CSF is low signal, like in CSF in the ventricles, dark signal, so the suspected MRI sequence may be T1, diffusion weighted image, or FLAIR. Going now to the next step. White matter. Look at white matter. If white matter brighter than the gray matter, so the sequence is T1. However, if white matter darker than the gray matter, now the sequence may be FLAIR or diffusion weighted image. FLAIR appeared clear details and outline. However, diffusion weighted image hazy outline. This is by imaging you can differentiate between FLAIR T1 and diffusion weighted image when CSF appeared dark. Another different sequences for the brain and different planes also. As we see here, the CSF in the globe is bright, and in the cisterns of the brain and subcortical sulci, temporal horn of lateral ventricles is bright. So fluid is bright and subcutaneous fat is bright, so it is T2. Also, this is coronal image T2 because CSF is bright. However, when CSF is dark, like these, all the other images, the CSF is dark, so return to the low. White matter, look at white matter. If white matter appeared more brighter than the gray matter, so this is a T1. And also confirmed by presence of high signal of subcutaneous fat and retroorbital fat. As we see here, the extraocular muscle and the optic nerve within the bright fat appeared here. The globe fluids also appeared low signal like CSF fluid. However, if the white matter like this is darker than gray matter, and this sagittal image of the brain, and this also axial image of the brain, white matter appeared more darker than gray matter. So now you are between FLAIR and diffusion weighted image. Look at the outline. If the outline and the details like this orbit is clear, so you are dealing with FLAIR image. However, if the outlines, look at the orbit here comparing with this orbit and the outline of image is hazy, so you're dealing with diffusion weighted image. So this is sagittal FLAIR image, and this is axial FLAIR image, and this is axial diffusion weighted image. Also, if there are any confusions as we discussed before, look at the parameters TR, TE, and the flip angle. Or look at the bottom of the film. The sequence is written on the bottom of the film also. Now, can you tell which one sequence of the brain this axial image? This axial image, first CSF appeared dark, so you deal with the three sequence T1, diffusion weighted image or FLAIR. White matter is darker than the gray matter, so this is not T1. The outline is hazy, so this is diffusion weighted image. So first step, look at the ventricles. Second, look at the white matter, and then look at the outline. This is diffusion weighted image. Again, CSF is dark, so follow the three steps. CSF is dark, so there are three sequences suspected. Look at white matter. It is dark also, so T1 is excluded. Outline is clearly and the details appeared good. This is the head of caudate nucleus, lentiform nucleus. Everything Sylvian fissures appeared detailed, so now you're dealing with the FLAIR image. Brain tissue in the FLAIR image appears similar to T2 weighted image with gray matter brighter than white matter, as you see, but CSF is dark instead of bright. Again, challenge image. CSF is dark, so you suspected 1 from 3. Look at white matter. If white matter is brighter than gray matter, so you finished your diagnosis. This one is axial image T1 weighted image. Also, subcutaneous fats appeared bright. In the T1, we can detect the anatomical details clearly in this sequence. Another image, this plane is coronal plane. Coronal plane showing CSF is bright and the fat is bright Parapharyngeal fat is bright, so you're dealing direct with the T2 wetted image. If you look in the T2, you can look clearly for the vessels because flow within blood vessels is black in this sequence, like this superior sagittal sinus, which is showing black signal within normal signal in the T2 wetted image. White background with hazy outline representing T2 star or gradient echo or SWI sequence. This sequence is good for calcium or blood detection. Again, CSF is bright and subcutaneous fat is bright, so you're dealing direct with the T2 sequence. In the T2, the abnormal signal appeared bright. White background with hazy outline representing susceptibility weighted image, SWI. This sequence can be used to detect hemosiderin or calcifications within the brain with high sensitivity, particularly in diffuse axonal injury. Again, white background with hazy outline representing susceptibility weighted image or T2 star or gradient echo. All these same name, however different physics, a little bit different physics, but the same effect. Any abnormality can be detected as a black dot like this hemosiderin within the white background, and this hemosiderin, if it is subtle, can be detected by this sequence. And this different sequence for the same patient showing abnormal pathology here. However, now we study the sequence. First, look for the CSF. If CSF bright like this in the subcortical sulci, so you're dealing with T2 weighted image. However, if the CSF appeared dark and the white matter is darker than the gray matter, so you're dealing with the FLAIR image because the details is clear also. However, the white background representing SWI, susceptibility weighted image. What about this sequence? This is not MRI sequence. Why? Because subcutaneous fats appeared dark and calvarial bone appeared bright. So this is CT image. This is CT and the others are MRI, different sequence. Also, if there are any confusions, look for the parameters, TR, TE, and the flip angle, or the name of the sequence as we see here in the bottom of the image. As you see, these lesions appeared bright in the CT, representing hemorrhage, which confirmed by the susceptibility weighted image as dark signal within white background. Again, the same patient. We look at the first row only because this contrast and advanced sequence. This sequence is called fast gradient echo brain volume imaging 3D, and with contrast you can detect it by presence of this contrast in the sagittal sinus. This sequence is diffusion weighted image because white matter appeared darker than the gray matter and the hazy outline of the lesion of the brain, so diffusion weighted image. And also through the parameters you can detect it is diffusion weighted image or through the parameter. This one is a gradient echo image due to white background, and the lesions appeared here with dots of black dots. These black dots representing blood. And this advanced sequence is called fast GRE BRAVO or Bravo, which representing brain volume imaging 3D. We'll talk about it in advanced lecture in the future. Now, this is a gradient echo sequence showing abnormal black dots within the white background representing hemosiderin within this lesion. Again, this is a T1 weighted image due to subcutaneous fat and fat within retroorbital spaces, and fluids appeared dark in the globe and in the CSF and cisterns of the brain. So this is a T1 MRI sequence. What about this sequence? CSF appeared bright and the white matter is darker than the gray matter. So this is not T1, and the details appeared clearly. So this is FLAIR image, not diffusion weighted image. In the FLAIR image, you can detect the abnormality as a bright objects near the ventricles which showing a low signal due to flowing CSF. So the flowing fluids only is suppressed. However, the other abnormality can be detected, particularly the periventricular abnormality. However, these lesions which appear the low signal in FLAIR representing Virchow's Robin space due to flowing blood appeared low signal, so this is Virchow's Robin space or perivascular space. This is the same patient with hazy outlines and the white matter appeared more darker than gray matter and CSF is dark, so this is diffusion weighted image, and this is confirm also presence of this abnormality which showing low signal. So low signal abnormality in the diffusion weighted image representing no restricted diffusions or no acute infarction confirm the diagnosis of Virchow-Robin spaces. So this is the orange ring representing Virchow-Robin spaces. And this is the 3 steps which followed to detect the sequence, low signal of the CSF, white matter more darker than the gray matter, and outline is hazy, so this is diffusion weighted image. Again, white background with hazy outline, so this is the susceptibility weighted image, sometimes called T2 star or gradient echo. And this sequence we can detect blood as hemosiderins or calcium as a black dots within this white background, like these dots which appeared black, and this representing calcium within choroid plexus in the lateral ventricle. Again, different sequences and plans for the same patient. As we see CSF when it is bright and the fat is bright, so the diagnosis of T2 is very sequence as a sequence is very clear. However, if the CSF is bright and the fat is suppressed, so this is a stare image. The other sequences showing the CSF is dark signal, so this is 1 from 3. T1 can be differentiated by this white matter, which is more brighter than gray matter, so this is a T1. However, if there are hazy outline and the white matter is more darker than gray matter, so this is the diffusion weighted image sequence. If this hazy outlines is not appeared like this, which appeared clear, and more details appeared like this also and like this, so all these are FLAIR sequences. FLAIR sequence, CSF appeared dark, white matter more darker than gray matter, and the details appeared clear. Also, in the FLAIR image, we can diagnose MS clearly. If compare here in the T2, we can detect the abnormality like this foci and this foci of high signal representing plaques of MS. However, in the FLAIR image, it appeared clear because the background is black. So the white dots can be appeared clear, so it's more sensitive for diagnosis of MS plaques. Also can diagnose other plaques like these plaques in the proximal cervical spine. Diffusion weighted image, if the plaques appeared bright in it, representing activity. So this is the rules of different sequence of the brain can reach to diagnosis, can detect the sensitivity of the number of abnormality and also the activity of the lesion. If there are any confusion, return to the parameters TR, TE, flip angle, and the name of the sequence. Through these parameters, you can detect the sequence also, because this representing the timing of radio frequency pulse which produce this sequence. Actually, I've prepared separate presentation about these MRI physics pulse sequences. I will discuss it with you in the next video, so wait me. Thank you very much for your watching, and this is my reference from my daily work cases.